We are so excited and happy to see all of you. And I, on behalf of the family of Prodigals Home and the Office of the State Commissioner for Persons with Disability, Nagaland Kohima, extends a very warm welcome to each and every one of you who are here this morning.
In 2016, UNICEF analysis of 15 countries revealed that among a number of factors, including income and gender, the role of disability was the most dominant in contributing to whether children attended school or not. Children with disabilities were likelier to have never attended school in the first place. Such findings contain profound implications, not only in terms of unfair educational practices, access, but also in terms of the life choices and opportunities denied. Because education is the gateway to children's full participation in society. That we all know very well. Without education, then the next step through life, it gets affected, it's impacted. And so this transition into adulthood, opportunities for employment and engagement with their communities, all these get affected because of the lack of education. Now, all the facts stated above, these I have mentioned about, global analysis, statistics and things like that, but all the facts that have been stated, it holds true for our children with disabilities here in our state. First of all, we have to be brutally honest and acknowledge that disability in general was a totally neglected sector for the past many years. Including education. This includes education, so all matters concerning children with disabilities, including education, was, completely, because the sector itself was completely neglected. So all these different aspects of life, it was completely neglected. One of the biggest challenges that we have with children with disabilities and persons with disabilities in general is the lack of data. Everywhere in various parts in the country and the world overall, so the availability of credible data is always a big challenge. But here in our state, it's so much more, more challenging because, as we all know, data is very important. In anything, data is something we seem to be learning only now and taking, paying more attention to it. But for so many years, data was also something that I think we have really neglected. So we have barely any data in, various sectors. And in disability, it is, it is really very poor. Even generally, the number of persons with disabilities in our state, we are still only following the Census 11 data, the figures, and that figure itself is, an underestimation. The WHO, the data is, 15% of the global population, total global population, has a disability. They are born with a disability, acquire a disability, or are living with a disability. So when we know, the global statistics are 15% plus 15%, more than 15%, but at least 15% of the world's population has a disability. Now here, according to our Census 11, it is only 1.5% of our total state population. So that is a very, very gross underestimation that we are still working with. So we're waiting for the latest census to be completed, which I hope will be more, of a proper figure that we get. So, but in any case, this lack of data is a challenge that we are, one of the challenges that we face. In many ways, children with disabilities, they continue to be, the uncounted. They are not being counted. With regard to when we talk about children with disabilities, how many are there? How many are out of school? How many are in the school, actually in the school? How many have assistive technologies to aid their education? In what manner do their disabilities serve as a hindrance hindrances to their education. You know, when we talk about disabilities, there are again many people who think about only one disability. For a person like me, I'm in a wheelchair, so she has a locomotor disability, she has a disability. It's very visible, it's clear. But many people, there are so many different types of disability. There are different categories of disabilities which many people are still really very unaware about. And on top of that, there are some disabilities which are not visible at all. You know, when you look at a person, you will not even know that that person has a disability. So now, we don't even have any figures, any data on how many types of disabilities, you know, children with different types of disabilities, how are these disabilities affecting, you know, their affecting their education, what are the hindrances, you know, the obstacles they are facing. We just don't have any of these kinds of you know, any proper information or data on these kinds of things.
So the first thing is the access to information. Access to information is something is very, very, very important. Whether it is in the education sector, whether it is in health, or wherever the section may be, we have to give wide publicity of the information. We need to circulate information to the public so that it reaches from the top to the bottom level in the community, at the same time in the department. So this disseminations of informations is very, very important, and then this is something our department is also failing from their parts, as we see. So this is something very important. The informations related to educational privilege and opportunity for persons with disability doesn't reach to the children with disability and their families. So this is one of the biggest issues. This is why the parents, the families of children with disabilities, they are not coming out from their homes for education. And then, when I say these informations, there should be an information accessibly. In the schools, in the colleges, or in the department, whenever they send out the informations, it has to come also with the accessible format. Like if a blind person have to read the informations, the guidelines that the education department usually hand out, then it is not accessible by a person who is blind, or it is not accessible by a person who have a low vision. So these things also have to be kept in mind so that it get access by everyone in the community, everyone in the society. And then another one is admission. Admission is one very, very important thing to start a formal education in this school. So when we talk about the admission, there has been a numerous, uncountable denial of admissions in the schools. So there has been uncountable denial cases in many schools. This is just because the school is not accessible. The school doesn't have accessible buildings. The school doesn't have accessible campus. The school doesn't have special educators. Madam has already highlighted about the special educators also. So this is one of the challenges this is one of the biggest challenges in the school. I think all the points are equally important also. Nothing is bigger, nothing is more important, nothing is less important. So this admission denial should not happen. In some cases is that the headmistress or the headmaster of the school is willing to give the admission to the child, but the teachers will go against that admission because the burdens comes to the teachers, and the teachers are reluctant to take care of those children. So those cases are also there in many schools. And then in these cases, I would also request also the concerned departments, the people to look after the welfare of the children with disability, and also pass appropriate information to the schools, to the teachers, and also to the head of the institution.
Inclusion of persons with disabilities is not only essential but their birthright. I have lived with persons with disability I have a brother who has dyslexia, and who couldn't cope with the unforgiving and unaccommodating system of education and eventually had to drop out from school. I have a niece who was born with autism and multiple disability, who for one couldn't get any diagnosis within the state for getting admissions in schools. I run an inclusive school called Bumblebee Inclusive School, which is in Kohima. We've been running this since 2012, and we've been working closely with children with special needs. However, we have also had our share of challenges in terms of acceptance and inclusion with our own, in our own environment. But nevertheless, we've been able to create an environment of inclusion and acceptance within the school, which has also filtered down to a lot of homes. A lot of talks are being held on inclusion. We're all here discussing inclusion, and it's become a very fancy term for us to use. However, it boggles me to understand why inclusion somehow remains an exclusive idea. Why are persons with disability not included in the idea or discussion of inclusion? Inclusion is not about what people with disability want. It is about what they need. Persons with disability have to be included in planning and solution. As we come here to discuss about the rights of persons with disabilities, I would like to stress on the importance of creating awareness of persons with disabilities in schools, workplace, and community as a whole. Inclusive education is the most effective way of giving a fair chance to all the children to access education, learn, and also develop skills for them to thrive. However, inclusion will remain a beautiful dream unless intentional and constructive steps are taken to accommodate these children. And what better time to act if not now? We need to work on removing barriers. When we're talking about barriers, we're not only talking about accessibility to our buildings, to our schools, to our homes, but a lot to do with our attitude. We need more trained professionals in our state, like my fellow colleagues have already mentioned. We require more schools to open door so that to persons with disability, because schools should be for all. We need more vocational training institutes. We need to create more inclusive environment in our workplaces to also create opportunities for people with disability to have jobs. Now, it is also pertinent to understand that teacher trainings and resource sharing should be intensively introduced in mainstream schools to allow inclusion to happen in a much broader manner. Why should the idea of inclusion be only limited to a special educator, a counselor, a psychiatrist, or a person or a family that is infected with a disability? Why should we limit it only to the social welfare department, the Samagra Shiksha, or the Disability Commissioner's office? Because we're all capable of creating an impact if we want to act on it. Because it's our attitude that determines our actions.
I believe that this program will enable me to learn something which we are ignorant. So I am here with a sense of guilty. After hearing from you, we realize that we have not done many things that what we could have done. So I take this as an opportunity to hear from you what are the main issues and to introspect that how we can improve ourselves. The department, in which ways the department can find solutions for the issues. And I will not take much time. The few things what the department is already doing. As of now, we have 35 special education teachers attached to the EBRCs. So the roles and responsibilities of these EBRC coordinators, as he said, they are overburdened. 35 special education teachers for the entire state is very less, I must admit it. And the sum of the programs the Samagra Shiksha has been carrying out, like identifying children with disabilities, providing them incentives, providing them assistive devices. So these programs have been done by the Samagra Shiksha. As Ma'am has pointed out, it is our basic responsibility, but since all the mission mode projects are implemented by the Samagra Shiksha, these responsibilities are handled by the Samagra Shiksha. But I do admit that the Department of School Education should completely involve itself in these activities. We cannot simply say that these are mission mode activities, so we are not aware of it. So that's a lapse on the part of us. And the SCRT has been conducting training to teachers and these special education teachers attached in the EBRCs time to time. But I do admit, as one of the resource person has pointed out, the teachers attend the training programs, but no follow-up. Since we do not follow up, how many of the teachers have attended? After attending the program, what have they done? We are not going to in that aspect. That is why someone has pointed out the programs become namesake programs. Of course, the training programs are conducted with good intentions, but unfortunately, since there is no proper follow-up, that's why it seems that they are namesake programs. Of course, the programs are not conducted with intention of namesake, with good intentions only it conducted, but we lapse in the follow-up programs. And presently, you know that the Department of School Education is implementing a World Bank project, the Nectar project. It's a 650 crore project for 5 years. So now we are in the 3rd year of the project. So the Principal Director of School Education, he himself is the project director for this. And recently we have come in collaboration with some resourcery NGOs, particularly the Change Inc. There is an organization. So they are also conducting training program for the teachers. And the Nectar has a program to take forward this training program to teachers in a large scale. As of now, we are conducting to a small group of teachers, but the Nectar has a plan to take forward this to a large group of schools. And then the Nectar has the concept of lighthouse schools. In each district, one school will be designated as lighthouse school, and that will be built with the state-of-the-art facilities. Whatever facilities are required to a top-class school, that will be there, including human resources. So, the many aspects of the grievances reported today could be taken care by these lighthouse schools, since it will be a resource sharing center. So the special education teachers will also be there, and their services can be extended and shared by the schools, cluster schools which are attached to that lighthouse schools. So these are the things as of now what the department is doing. And I am grateful to our Commissioner Ma'am that I came in contact with her in the year 2020 when we conducted this tele-education program during the COVID time. In fact, at that time, Ma'am, she made me little frightened because I was the in charge for the tele-education, and we were making the videos with the help of a small group of teachers. So the first round has completed, we were not, I should say that we were ignorant. We have not included any videos for the special children. So when this first program was completed, Ma'am contacted the principal director and she pressurized, you do whatever you want, but it should be there for the next round. And she helped with us providing 4 special education teachers. So we use their services, and in that way only I came in contact with ma'am. Of course, she is like a tigress when it comes to your rights. Because my principal director told me, don't go for confrontation with her, do what she says. But when it comes to the solutions, when we put the things into practice, she gave a motherly support. So I am very happy to come in contact with such a person. And regarding the special education teachers, we have a recent case in the Supreme Court is going on. So the Supreme Court has directed the department to appoint special education teachers in all the schools. And the Supreme Court has asked us to identify the posts which are redundant posts. Some posts should be converted into special education teachers. So we are in the process of identifying those posts which can be converted into special education teachers. We have identified nearly less than 200 posts only. But that also, when we go into the practical aspects, that nearly 200 posts, many posts will be getting retired. The persons, those who are occupying now, they will get retired in due course of time. But thanks to God that after coming and attending this program, something struck my mind. Like, we have nearly 10,000 excess teachers now. It's in my mind only, okay, now it's not the view of the department. We have more than 10,000 teachers, surplus teachers, when we consider the pupil-teacher ratio. Practically, when we say in some part of the state, we have excess teachers, some part of the state, we have shortage of teachers. So the rationalization work is going on. The department is very sincerely working on the rationalization of teachers. So now, in the middle of the program, it comes to my mind. When we have the surplus teachers, why don't we, instead of identifying some other post, creating a new post, that takes a lot of time. It's a very hectic task. Creating the post has to go up to the cabinet. We have to find out the financial resources, finance department approval, PNDR approval. It will take a lot of time. So I'm thinking to prepare a proposal to the government. Out of these excess teachers, even the department is working on golden handshake, the excess teachers to give BRS. So out of these teachers which we plan to give BRS, why not some teachers be trained as a special education teachers and utilize their services? So this, I will explore more the possibilities of this one. How can we carry forward? And I will submit a report to the government, and I will try my best to push this proposal. Since already the teachers are in service, it is a matter of giving them training. So, and already there are many partners who are willing to give training. Our ma'am also has pointed out, and SCRT is also in the service of providing training. So we can intensify it, and we can take forward. So I am sure that something good can be brought out.